Speak to Shana Casale, who is an emergency room nurse at Mercy Hospital in Miami, Florida. Shana, thank you so much indeed for taking your time when you guys are under so much pressure. We just want to know what it's like for you in Miami at your hospital.
From day to day, it changes. All the policies are being put in place as quickly as possible by the administrators and our leaders. It's the least I could say is it's chaotic. Just as it is everywhere else in the world, we're handling it the best that we can with the resources that we have. And that we beg for people to please stay home and take care of each other and consider that all of us in healthcare go home to our families as well, and we need to keep them safe.
In terms of the disease, and I'm not really asking for a medical assessment of how you're treating people, but how different is it, this disease, in terms of what it means for your interactions with the patients? And then there's also the psychological effect, of course, because they can't have their family coming to see them. You're the only people that they see. But in terms of how you interact with them, how different is it to everything else you've done before?
Well, there's heavy precautions put in place. We have quite a bit of personal protective equipment that we have to don and doff when we handle these patients. So we try to be as personal as possible in consideration of that, because we look like anybody else. You wouldn't be able to tell us apart when we have on the masks, the gowns, the head coverings, everything. We have to consider that these are still people as well, and that they don't have their support system. We are those people for them. So we do our best to be as compassionate and kind, and consider that they would like to reach out to their families as well and provide that kind of care for them. So phone contact and internet as much as possible. And in the unfortunate events that they happen to be one of the more severe cases and intubated, we try to look at them as our family members as well, and treat them the same as we would anybody else. It's very important that we provide them those supports.
Okay, Shana, stay with us. We want to play a clip, and I know you probably won't be able to see it, but you'll be able to hear it. It's a nurse here in the UK. She works for the National Health Service. She had just completed a night shift. And I don't know if you know what the situation is like here in the UK. People have been panic buying for about 10, 12 days or so. Many supermarkets are almost empty. So this nurse went after an overnight shift to her local supermarket, and she found nothing, and she recorded her reaction. Have a listen.
And there's people are just stripping the shelves of basic foods. You just need to stop it.
She's saying she couldn't find basic foods. I don't believe the situation has become that bad in the United States, but still, what is the psychological impact for you? You said you have to go back to your family as well. What do your family say to you when you come home? I mean, do they at all think that you shouldn't be going to work, even though they know you're saving lives? Because you're putting yourself in danger.
Fortunately, my family is very supportive of what I do. I've been doing it for a while. They understand that it's very important for people like myself that have trained for situations like this to be in place so that we can provide that relief for everybody else in our community. For me, psychologically, I come home in the middle of the night. I used to be overnight, so I worked those shifts as well, but I now work a mid shift, so I come home in the middle of the night. I strip down before I even enter my home. I put everything directly into the wash because I'm afraid to expose my family to it. And I immediately go to the shower and try not to touch anything in between. That's the best that we can do in this situation.
Shana, thank you so much indeed for talking to us. Yeah, I can imagine. And that's particularly why we appreciate you taking the time to speak to us despite everything that is going on and your professional responsibilities. Like everybody in the world, we all thank you so much indeed. Take care. Shana Casale speaking to us from Florida.